49 CFR Part 382 was established by the Federal Motor Carrier Safety Administration, FMCSA, to combat impaired driving caused by alcohol and drug misuse among commercial drivers. It applies to all CDL holders operating vehicles with a gross vehicle weight rating of 26,001 pounds or more, vehicles transporting hazardous materials requiring placards, or vehicles designed to carry 16 or more passengers. The regulation requires employers to implement drug and alcohol testing programs and educate employees about the dangers of substance abuse. Testing is required under various circumstances, such as pre-employment, post-accident, and random checks. Additionally, Part 382 outlines procedures for handling violations, including return to duty and follow-up testing for drivers who fail to comply. The regulation also holds employers accountable for record keeping, ensuring accurate documentation of all testing activities. This creates a transparent process that protects both employers and employees while ensuring the safety of the traveling public. By implementing these guidelines, the FMCSA aims to reduce accidents, injuries, and fatalities on the nation's highways. Compliance with 49 CFR Part 382 is not just a legal obligation, but also a commitment to creating a safer work environment and fostering public trust in the transportation industry. Under 49 CFR Part 382, drug and alcohol testing is required to ensure that commercial drivers remain compliant with federal safety regulations. Testing applies to drivers performing safety-sensitive functions, including operating a CMV, inspecting vehicles, or loading and unloading cargo. There are 5 primary scenarios where testing is mandated. Pre-employment testing. Employers must test new drivers for drugs before they perform any safety-sensitive tasks. This step is essential to confirm the driver is drug-free from the outset. Alcohol testing is not required at this stage, but can be conducted optionally. A negative result must be documented before a driver is allowed to operate a CMV. This type of testing is conducted throughout the year to ensure compliance without prior warning. Employers are required to use a scientifically valid random selection method and ensure all eligible drivers have an equal chance of being tested. Annually, at least 50% of drivers must undergo drug testing, and 10% must undergo alcohol testing, though these rates are subject to FMCSA adjustments based on industry data. Testing is mandatory following certain types of accidents: when a fatality occurs, when the driver receives a citation, and there is bodily injury requiring medical attention, or disabling vehicle damage. Post-accident testing for alcohol must occur within 8 hours, and drug testing must occur within 32 hours of the incident. Supervisors trained to identify signs of drug or alcohol impairment can initiate this testing. Observations may include physical symptoms like slurred speech, erratic behavior, or the smell of alcohol. Both alcohol and drug tests must be conducted promptly to ensure accurate results. Drivers who violate substance use rules must complete a substance abuse professional SAP, evaluation, and return to duty testing with a negative result. Follow-up testing is unannounced and occurs at least 6 times within the first 12 months after returning to duty, with testing potentially extending up to 5 years. Under 49 CFR Part 382, drivers are entrusted with several key responsibilities to ensure both their safety and the safety of others on the road. These obligations not only safeguard against impaired driving, but also contribute to maintaining a culture of compliance within the transportation industry. Drivers must refrain from using alcohol or controlled substances while performing safety-sensitive tasks. Safety-sensitive functions are those critical to vehicle operation, including driving, loading cargo, or inspecting the vehicle. Alcohol use is prohibited within 4 hours of beginning a duty shift. Similarly, drugs or alcohol must not be present in the driver's system while performing these tasks. If a driver is found in violation of this policy, disciplinary actions such as termination or suspension may follow. It is the driver's responsibility to inform their employer if they are prescribed medication that could potentially impair their ability to perform their duties safely. Medications, whether over-the-counter or prescription, may cause side effects like drowsiness or decreased alertness. Drivers are expected to understand the potential impact of these medications and communicate openly with their employer. Not doing so could lead to serious safety risks. Drivers must comply with all testing requirements set forth by the employer. This includes submitting to both random and scheduled drug and alcohol tests. A refusal to take a test or failure to cooperate in the testing process is considered a violation of the regulation and is subject to the same consequences as a failed test. In the event that a driver tests positive for drugs or alcohol, they are required to undergo a substance abuse professional SAP evaluation. This evaluation will determine if the driver is fit to return to duty and will outline any necessary treatment or counseling. A driver is prohibited from returning to safety-sensitive functions until they have completed the required steps and have been cleared for return by an SAP. Drivers must avoid consuming alcohol while in a company vehicle or in situations where they are on duty. Even in non-driving situations, the potential for alcohol consumption to affect a driver's ability to perform their duties is high, and such behavior is strictly prohibited. Additionally, drivers should not possess open containers of alcohol while in their vehicle. Overall, these responsibilities underscore the importance of maintaining physical and mental fitness for duty. By adhering to these guidelines, drivers help foster a safer driving environment for everyone on the road. Failure to comply with these responsibilities can lead to severe consequences, including suspension or loss of CDL privileges. Under 49 CFR Part 382, testing is specifically designed to identify the presence of certain drugs that are known to impair driving and endanger public safety. The FMCSA has established a comprehensive list of substances that drivers must be tested for. These substances are chosen because they have significant effects on cognitive and motor skills, which are critical to operating a commercial motor vehicle, CMV, safely. Here's a breakdown of the drugs tested for. Marijuana is one of the most commonly tested substances. Although some states have legalized marijuana for medicinal or recreational use, it remains illegal under federal law for commercial drivers. THC, the psychoactive component in marijuana, impairs judgment, motor coordination, and reaction times. Even small amounts of THC can affect a driver's ability to safely operate a vehicle. Cocaine is a powerful stimulant that affects the central nervous system, leading to increased heart rate, impaired judgment, and potential for erratic behavior. Cocaine use in commercial drivers is prohibited as it severely disrupts decision-making, concentration, and coordination, critical skills for safe driving. Amphetamines and methamphetamines are stimulants that can provide short-term bursts of energy and alertness, but ultimately impair concentration and reaction time. These substances are banned in the transportation industry because they can lead to unpredictable behavior and impaired decision-making. Drivers who use these drugs may also experience mood swings, making them a significant safety risk. Opiates are central nervous system depressants that are known to slow reaction times and impair motor skills. These drugs, particularly heroin, morphine, and codeine, are tested for because they can cause drowsiness and cognitive dysfunction, both of which are dangerous when operating a CMV. Despite their medicinal use, the presence of these drugs in a driver's system is strictly prohibited unless prescribed by a doctor for a legitimate medical condition. And even then, the driver must notify the employer. PCP is a hallucinogenic drug that can cause violent behavior, impaired motor control, and disorientation. Its inclusion on the list of substances tested for is due to its severe effects on a driver's ability to operate a vehicle safely. The use of PCP is strictly prohibited in the transportation industry. These drugs were selected for testing due to their impairing effects on the nervous system, making them a serious safety hazard. Testing for these substances ensures that commercial drivers remain fit for duty, helping to prevent accidents, injuries, and fatalities on the roads. The process involves both urine and sometimes hair follicle testing to ensure accurate results and reduce the risk of tampering or false negatives. The drug testing process under 49 CFR Part 382 is designed to ensure fairness, accuracy, and accountability. It follows a strict protocol to ensure that all test results are valid and that drivers cannot tamper with or alter samples. Collection of samples. Testing begins with the collection of a urine sample from the driver. The process takes place at a certified collection site, which may be either a clinic, a mobile collection unit, or a designated workplace facility. The driver must present themselves for testing as soon as possible after being notified. The collection must be observed for random testing and for reasonable suspicion or post-accident testing to prevent tampering or cheating. To ensure the sample is accurately traced from collection to the lab, a chain of custody form is completed. This document tracks the sample's journey through each step, preventing any possibility of mix-ups or falsification. The chain of custody process is an essential aspect of the testing procedure to maintain the integrity of the test and the confidentiality of the results. Once the sample is collected, it is sent to a certified laboratory for analysis. The laboratory tests for specific substances, as detailed in Part 382, including marijuana, cocaine, opiates, amphetamines, and phencyclidine PCP. The sample is first screened for the presence of these substances. If the initial test is positive, a confirmatory test is performed to rule out any false positives and ensure accuracy. After the laboratory completes the analysis, the results are forwarded to a medical review officer, MRO. The MRO reviews the results and verifies the findings. If the test result is positive, the MRO contacts the driver to discuss possible medical explanations, such as prescribed medications. If the driver fails to provide a valid medical explanation for the positive result, it is confirmed as a violation. The employer is then notified of the test results, but the driver's confidentiality is maintained throughout the process. Negative results are typically reported within 1 to 2 days, while positive results may take longer due to the review process. Employers are prohibited from taking disciplinary action based on preliminary results. Action is only taken after the confirmatory test and review. The drug testing procedure under 49 CFR Part 382 ensures that the tests are carried out fairly, that drivers are given an opportunity to explain positive results, and that the integrity of the testing process is maintained. This detailed and regulated approach helps to uphold the safety of everyone on the road.